Today I'm going to be taking through a series of exercises for something called Piriformis Syndrome. Piriformis Syndrome is actually where the sciatic nerve, so the nerve that goes from your low back through your buttock, down into the back of your thigh, your calf, and eventually into your foot, becomes trapped via a muscle called your piriformis. Your piriformis is one of the muscles in your buttock, and it is a bit of a bugger because it does cause quite a few issues. The reasons it can cause these problems is through macro trauma, micro trauma, a shortening of the muscle, or alternatively actually through muscle spasm. So a lot of them do tend to interlink. So the macro trauma we would class as some kind of major trauma onto the area. So for example, if you're a footballer, you go and take a shot, you're about to shoot for goal, and actually the grass is slippy, you fall on your buttock onto that side. As you land on there, you're probably going to create some inflammation, some irritation. Actually, that can then start to cause this irritation onto the sciatic nerve, causing this discomfort down the back of your leg. So the micro trauma aspect of it tends to be more with repetitive movements, it's repetitive issues. So for example, long distance runners, these are one of the main cohorts that I tend to see people fall with sciatic problems that is resulting from the piriformis. But also you find it with tennis players as well. It's just where there's this repetitive shortening, lengthening, this overuse injury, and eventually it causes some irritation to that sciatic nerve again. The other way that you can get this micro trauma issue is less so with sport orientated, and actually another word for it is wallet neuritis, and that's because a lot of blokes tend to just sit on the wallet in the back of the pocket, and this constant compression just eventually causes some of this irritation that people do start to experience. If we then go on to the shortening of this, so this shortening is where things can be a little bit more tricky, because the shortening can either be due to something being over tight or something being weak and it trying to compensate and protect itself. So as it becomes shortened and tightened, it then squashes the sciatic nerve, and from that sciatic nerve squashing, you then start to get this sciatic sensation that people are quite well acquainted with. So in regards to the shortening side of piriformis syndrome of the muscle, you can actually find sometimes it's biomechanical as well. And then finally, the other one that we're going to talk about is muscle spasm that can cause this piriformis syndrome. And the muscle spasm is usually secondary as a resultant of pre-existing or previous injuries to the lumbar spine, to the sacroiliac joint, the joint between your pelvis and your tailbone, and also the hip as well. So if your body is trying to compensate, trying to protect for these underlying issues, and the muscle becomes tighter, it becomes shorter, or it becomes stretched, and again it can then cause some of the sciatic sensation that people get that is related to piriformis syndrome. So what are the symptoms? The symptoms of piriformis syndrome can be quite vague. So one of the major symptoms is this deep ache right within the buttock. The other sensation that people get that is really common again is the sciatic nerve sensation. Sometimes it's just in the calf and not in the rest of the thigh. Sometimes it's the entire way down the leg. Sometimes it can actually go down into the foot as well. Another pain which people can get in relation to piriformis syndrome is discomfort in the groin. This is usually due to a different nerve interaction or the way that the pelvis is moving. And then actually some of the journals do indicate as well that people with piriformis syndrome can start to develop digestion issues. And from this digestion issues, you can then get this connection with your thoracic spine, the neck, and the head. So it just kind of goes to show how much the body is interrelated. So the first exercise that you're going to do is stretching it. So I'm going to be stretching my left hand side so you can see what's going on. I'm going to bring my left knee up towards my chest, hold it with my hands, and nice and gently just pull it up towards the right side of my chest. If it's really quite sore, if it's really acute, start with 5 seconds and gradually build it up. But for most people, I'd recommend somewhere between 15 to 20 seconds. Take a deep breath in, breathe out, pull it a little bit further. The next level up of this is bend your right knee, put your left ankle on top of your right knee, put your hands in between your knees and onto your right knee, and then nice and gently just tug your right knee towards your chest, and that's going to create this really nice stretch just going straight through the buttock. Stage 3 of stretching is what we class as a modified pigeon stretch. So again, stretching my left side, I'm going to pop myself into this 90-degree position here. To really try and influence the hip, you need to try and keep your back a little bit straight, and you're going to be going, if it's your left leg, to about 10 o'clock. So as I keep my back straight, I'm just going to let my hip drop down towards the floor and lean towards that 10 o'clock position. To make it a little bit harder, what you may find, what I certainly find quite effective as well, leaning forward and just sort of moving around the hip and really trying to hunt out the corners of where you feel the stretch most. Same principle. Once you find it, hold it for that 15-20 seconds unless it's really acute. If you do find it starts to worsen things, then obviously do ease off. The next exercise that we're going to do is starting this strengthening phase of the Piriformis Syndrome rehabilitation. And the first exercise to do this is the bridge. So you want to use both legs of the bridge. You're going to keep your back, keep your neck nice and neutral, feet so they're about shoulder width apart, hands onto the side, and just lift your pelvis off of the floor. Get so that your body is really nice and straight, tense the glutes, hold that position there for about 3 seconds to 5 seconds, and then drop back down. Try and make sure that your knees aren't knocking together and they stay nice and stable, and then go back up. And this one, because it's a strength oriented exercise, you're going to start by trying to do it somewhere between 12 to 15 times, focusing on an endurance position, and then back down. So the next exercise after that is going to be the prone hip extension, so prone being on your front. With this one, you're going to have your knee bent. The reason your knee is bent is so that you're taking out the hamstring activation, just focusing on the glutes. And all it is nice and gently lifting your knee away from the floor. Get to the top again, hold it for a couple of seconds, and back down. Pull up again, and back down. So again, try and do this somewhere between 12 to 15 repetitions. Keep it endurance. You might do 1 set, you may feel comfortable doing 2 sets. Finally, the last 2 exercises that we're going to be doing is using resistance bands. So what you want to do is try and strengthen the abductors and the extensors. So first extensor, loop your foot into the resistance band. So make sure it's something that's quite stable. You don't want to be attaching it to a radiator and pulling the pipes off. Keep this nice strong upright position. From there, just bring your leg backwards. You may need to use something for some support, but you're trying to make sure that you're not just arching your back, it really is coming from the glutes. I personally always find benefit of just holding on to the target muscle just so I can make sure it's contracting. Again, hold it for a couple of seconds, slowly release back to normal. Make sure it's not a sudden release. The slower you do this eccentric movement going back, the more you're going to be activating the muscle, and actually the more you're going to be supporting the strength of that muscle growth. And then finally, abduction. So abduct to take away. Again, nice and strong position, and you're just going to take your leg outwards. Again, making sure that you're not leaning into this awkward position or leaning into that position. Try and keep nice and upright with your body. Take your leg outwards, and again, you may need some support. You can either do this as a repetition, same as this, or you can do it like we've said for the rest of the exercises. Take it outwards, hold it for a second or two, and bring it back to normal.